I'm Dr. Jayanth. I'm a pediatric orthopedic surgeon working in Bangalore. And today we are going to talk about a very common condition that affects babies and very young children called developmental dysplasia of the hip. It's called DDH. This is where the ball of the hip joint comes out of the socket. The condition can happen at birth or it may happen soon after birth. Parents are naturally worried when they hear the news that their child has a dislocated hip or DDH. But parents should not be worried because this condition can be completely treated and the child can be cured. The most important prognostic factor for DDH is age at diagnosis, because younger the child, the less the treatment and the better is the overall long-term outcome. So we rely on our pediatrician colleagues and obstetricians to refer children who have risk factors for DDH so that an early diagnosis can be made. So how is DDH diagnosed? In young children up to the age of 6 months, we use an ultrasound scan of the hip because the ball of the hip joint is made of cartilage. So this shows up better on an ultrasound rather than X-ray. In children older than 6 months of age or 8 months of age, the DDH can be easily diagnosed by taking a simple X-ray of the pelvis. Treatment of DDH depends upon the age. In babies up to the age of 6 months, we can apply a simple strapping to the leg. This is called Pavlik harness. The Pavlik harness treatment is continued for a period of 6 to 12 weeks, depending on the severity of DDH. And in more than 90% of babies, a Pavlik harness provides complete cure of the DDH problem. In children over the age of 6 months, up to the age of 12 months, up to walking age, we can do closed reduction, where child is given a short anesthesia and then using an X-ray machine and by placing some dye inside the hip joint, we are able to visualize the ball of the hip joint and accurately place it back into the socket without surgery, without open surgery. And then we apply a cast around the hip and the lower body called a hip spica cast, and this may be kept on for somewhere between 2 and 3 months. In children who have reached walking age, more than 12 months of age, then we may have to do open surgery. This is called an open reduction of the hip joint, and even the open reduction in younger children gives very good outcomes, and they are able to go on and lead a normal life without any disability. So the key message for parents whose children may have a suspicion of DDH or who have been diagnosed with DDH is to get the treatment done as early as possible, because younger the child at the time of diagnosis and treatment, the better the long-term prognosis. Thank you.